Hi, I'm Ed Hare, CEO of CoActiv Medical. Welcome to RSNA 2011 and some of the new exciting things that are happening in the field of imaging, whether it's radiology, cardiology, orthopedics, or basically any type of medical image created inside an imaging facility, hospital, or imaging center. Today we'd like to talk about some of the things that we're showing at RSNA 2011 for the first time. The first thing I'd like to talk about is the fact that we now completely handle the new DICOM standard breast tomosynthesis exams, from their acquisition, their display, and their archiving. And let me show you what they look like at the moment. The standard full field digital mammography exams that we've seen for the last couple of years are basically these four images on the side, which are two-dimensional images, and when they're looked at by the radiologist, they can window and level and do magnification and do various types of analysis in order to determine whether or not there's any type of pathology. But if there's issues that they can't see because of overlapping tissue or dense tissue, sometimes they have to bring the patient back for another exam. Now with the new breast tomosynthesis, they do a combination of those four images plus four images that are actually 3D images, which are multi-frame images. In this case, there's 64 frames, and it's done just in terms of tomography, so it's a 3D exam. And you can actually see as we scroll through them that it gives us the ability to look at 64 slices of the same breast and see possible pathology that was not visible on a 2D exam. The industry believes, and I'm a firm believer, that this could eliminate a lot of callbacks, eliminate some false positives and some false negatives, and perhaps reduce the number of the amount of radiation that a woman is receiving during breast examination over her lifetime, and increase the accuracy of the diagnostic reads taking place. So we see it as the future of breast imaging. The next item I'd like to talk about is probably the most exciting thing we're showing this year, and that is our exam browser technology, which is the industry's first and only zero footprint exam viewer that allows a clinician to look at exams on basically any device that runs a browser, which includes PCs, Macs, Linux machines, iPads, iPods, iPhones, Android devices, and we've even immediately before the show validated on the new Kindle Fire as well. It does on-the-fly 3D reconstruction, and it's the only device in the industry that allows real-time collaboration between multiple users, so that potentially an attending physician or referring physician, a radiologist, and even a patient could be looking at the same exam at the same time and actually looking at annotations, pointing the areas of interest, and being able to do a full analysis of potential pathology on an image, whether it's a 2D image, a 3D image, or any type of image that they're looking at. And this is available now, and we suspect that it's going to be a real hit going forward. The next product we'd like to talk about, and so far we've shown it to quite a few very key radiologists, and that's our new exam jacket. Exam jacket is an interesting tool that basically replaces everything that used to be in the old film jackets that we're probably familiar with from days gone by, which included not only the old film exams, but also all the other documents that had to get into the reading radiologist, including prescriptions, tech notes, any type of history on the patient, and as well as the prior exams, and replacing all that information with a digital representation that we call exam jacket instead of film jacket. And what it allows you to do is see everything that the radiologist needs from a single digital interface in the reading room without having to bring any paper or anything in, or bring up any other exams or any other information sources from different locations, because it all comes from the same place. And I give you a representation of how that works here. I just opened one exam, and this we're looking at here, and across the top we see all the priors for this patient, and each one of those, by hovering a mouse over it, you can't see it because it's kind of small on this screen, but it gives you all the information on the patient's name, date of birth, the date of the exam that was done, the description of the exam, the referring physician's name, accession number, and number of images going across. On each one of those, there's a little box you can click, and it'll give you the radiologist impression for the report that was done on the prior exam. And if he wants to see the entire report, you click on this, and the entire report is now visible right on the screen without having to open it and go anywhere else for it. You can bring any number of those up and look at them going across. It also shows discrepancy reporting. If any of the priors on here show that they have a different name on, which is possible. If it was a woman who was having some exams done under a maiden name and then a married name, it will show as a discrepancy, but it flags the radiologist to in fact make sure he is looking at the right exam for the right patient, because you can compare the medical record number and date of birth at that point. So it just adds as an instant discrepancy check to make sure he has the right exam when he's comparing it to a prior. By clicking on another exam, you can add it to the window, and it takes the real estate from the number of monitors that he has in use, whether it's 2 or 3, and shares the real estate equally between the 2 exams. Opening a third exam then subdivides the real estate even further. Opening a 4th exam takes the real estate that's been divided now in quarters. Opening a 5th exam takes the first section over here. Let's close this to get it out of the way. It's just a distraction. And we can continue to open up to 8 exams on 2 monitors, or 12 complete exams if they're using 3 monitors. And this allows the doctor then to look at all the priors that are of interest to him in reviewing the new exam, and he can take any image or any exam and move it to any position on any of the monitors that are currently in use by just dragging, dropping those from one monitor to the other, moving them around so he can put the appropriate one side by side for instant comparison. He can take any image of any exam and instantly make it full screen to look at it in full size, and go back down again to the original position on both the image and the exam. If he forgets where he was, right click up here, we'll take all the exams and putting them back exactly where he loaded them at. Viewable within each one of the exams is the full report, of course, and any attached files that would be here. I don't have any to show you here because most of those have patient information on that I can't show, but it could be clinical notes, it could be the prescription, it could be a driver's license, it could be a photograph of the patient, it could be an audio clip that was done, it could be a video clip that was taken at an accident scene to show how the person was extracted. Anything that might be of interest to the radiologist that was attached to the exam during the acquisition process of that exam when it was originally done would be instantly visible to the radiologist from a single interface without it having to go anywhere else. It should increase his throughput, increase the accuracy, and save him a lot of time and effort. And when you close it, it just takes everything and closes it back to where you originally were. Yeah, we think the exam jacket will have a significant effect on the productivity of radiologists by allowing them instant access to all the possible information he needs to do proper comparison of priors with a current exam. And right now we all know that with reduced compensation for exams, that there's a lot of pressure to do as many exams as possible, and this will help throughput and accuracy in the reading room. In addition to our breast tomosynthesis interface that we were talking about earlier, we're also announcing that we're doing an integration with PenRad, which is the largest provider of mammography information systems. So now from CoActiv you get a PACS that not only handles primary diagnostic mammography reads on the PACS workstation, it's now capable of doing breast tomosynthesis 3D exams in the DICOM standard. We were one of the first PACS vendors to integrate with Dillon technology on their breast-specific gamma imaging. So it makes CoActiv a full breast solution as well as a full-fledged PACS and wrist solution as well. So I think we're becoming more important to more people. Also this year we're introducing our enhanced diagnostic capabilities on echocardiology exams for the cardiologist to allow them to do all their primary measurements right on the PACS workstation. So from CoActiv Medical, we always give you the best deal. And if you were not at RSNA to pick up a free deck of our radiology playing cards, please hit our website and you can click there to request a deck of playing cards that we'll be glad to send you in the mail. Thank you for taking time to visit with us.